Hello everyone, welcome to Health Research with me. I'm Dr. Marzia Najafi, and today I'd like to briefly introduce fundamental of qualitative research. This is part one, and in this meeting, I will focusly talk about qualitative research in health area. Well, what is a qualitative research? Qualitative research is a method used to explore and understand people's belief, experience, behaviors, and social context through non-numerical data. What is this data? These data are like words, text, image, and unlike quantitative research, which is focused on measuring, comparing data by statistical software. In qualitative research, we are seeking for deep understanding about why and how one phenomena is happening. This approach is especially useful when we are exploring complex issue, new or sensitive area, or when we want to understand cultural norm and individual experience. It's also valuable for generating theory or evaluating policy from multiple perspectives. Now let's briefly go over the main method of data collection like interview, focus group discussion, observation, and document or content analysis. What is interview? In interview, there is different approach, but the most common way of interview is reaching to person and conversation, having conversation with person, usually semi-structured interview which allow to participant to express their view and their perspective, their experience in their own word. In focus group discussion, we have a facilitator to help explore social interaction and shared knowledge. In observation, a researcher is watching behavior in natural setting. In document and content analysis, we are analyzing existing text or media to understand pattern and themes. When it comes to sampling, in quantitative study, typically we are using purpose sampling, choosing participant based on relevance to their research, and other technique include snowball sampling or maximizing variation sampling. In snowball sampling, we are choosing participant, and this participant during interview they are referring us to other. And in general, instead of large sampling like quantitative study, here we continue gathering data till data saturation. But what is the meaning of data saturation? It means reaching to the point that we cannot gather new terms from our data. And how we can ensure the quality of qualitative research. It depends on trustworthiness, like credibility, transferability, dependability, and confirmability, ensuring the findings are accurate based on the feedback of participants, providing enough context so others can determine if the finding apply elsewhere, being consistent and well documented, and remaining objective and transparent as a researcher. To give you an example, there is a published qualitative study by me and my professor on enforcing Iran national policy on banning advertisement of unhealthy product, which is published in BMC Public Health. In this study, interview conducted with 24 policymakers and health experts, and study explored the challenge and solution of implementing this policy in Iran. Finding of this study is helping to clarify social and institutional barrier to public health regulation. In conclusion, qualitative research is essential for understanding the deeper layer of social phenomena, especially in health, education, and policy. It goes beyond number and gives us rich human-centered insights that are crucial for making effective decisions. Thank you for your attention. If you have any question, feel free to reach me to my email.